everybody who sits in my counseling office has always said, I would never have thought that I would be in this position. I would never have thought that I would be a person diagnosed with depression. I would never have thought that my marriage would have failed. I would never have thought that I would have adjusted so poorly to the loss of my mother or my father. No one ever feels that they will be in that position, and not one of us are exempt from a bout of poor mental health, not one of us.
The Canadian Mental Health Association Windsor-Essex County Branch is a leader in delivering mental health services, working to achieve the highest quality of life and to promote mentally healthy people in a healthy society.
Mental illness affects everyone. I think there's very few people who aren't touched by it in some way, whether it's themselves or a family member or a friend.
The mission of our organization is to promote mental health for all persons, and there's no shame in having a mental illness.
A lot of what we do is a lot of what all of us need, which is inspiration. It's not us doing it for the person. A lot of times people with mental illness have stopped hoping.
Often people have the tools to deal with this themselves. They just don't realize what's wrong.
There is a stigma to mental health, and that prevents people from accessing the services that they really need.
But there's also the stigma the person themselves has, and oftentimes they grow up in a family, they grow up in a community where they don't respect mental illness or they don't feel very good about it, and it takes a long time to deal with your own feelings about having a mental illness.
There is recovery, and people with a serious mental illness can live meaningful and happy lives with the appropriate supports.
But for recovery to happen, we have to assist that person in understanding that they are having a lapse of poor mental health, and sometimes giving it a name, like anxiety or depression, helps that person understand that it is a clinical term and that help and treatment are available.
One of the things that we have really focused on, and it's unique, is the integration of primary care and mental health. For so long, primary care services, which is like you going to your general practitioner, have been siloed off from mental health services.
Our goal is actually to work with them holistically. Everything from their physical health issues to something that for them may be significant.
I'm kind of one of the starting points of the team where I see the patient and then I can identify some of the problems and then refer them on to other members of the team, and then we can start to deal with their problems in a more comprehensive manner. So for example, somebody comes in with diabetes, and then later on I may find out that part of the reason that their diabetes is so poorly controlled is because they're feeling depressed about something.
Everything that you and I consider important in our lives are the same things that people with mental illness consider important in their lives. So there's no real difference. It's just that we're there to sort of help them through that path.
One of the incredible things of this agency is just to watch the staff and the times I'm in the office, and you see it in their eyes, the passion and the belief in what the cause is. And I'm always so pleased to see that at this agency, such a dedicated and hardworking staff.
I've seen our staff after 5 o'clock when something happens with a client stay to make sure that that client is taken care of. I know some of them take calls after hours and that kind of thing.
I think anywhere where you work with an individual and you get to see them realize something that has true meaning for them, you get something back yourself, and that's probably why you're in the field, and that's probably why you're working for the organization.
I got sick first at the age of 35. I was very lucky I had a late onset, and I have battled psychosis, and I've been in the hospital for 7 or 8 weeks at a time. I think it really helps because you can understand where they're coming from. I've been through it many times, and I have full memory of it and what my family and my friends were trying to do. Most of the time it didn't work. But I can understand now how to work with a client who does do that.
Depression doesn't have to be a normal part of aging, and often is not. I certainly try to encourage people that they need to take things like depression and anxiety and stress very seriously as a mental illness. And they're things that it can creep up quite quickly as a person tries to deal with a lot of changes that happen.
Actually, I first came to CMHA as a client. In 1990, I lost my husband, and I came through the bereavement program that CMHA offered at the time. I met people my age, older, younger, survivors of violent crime, young mothers, which I also was at the time, who had already been through what I'd been through, and I feel bound to give back in any way that I can to others who might find themselves in a similar scenario.
My name is Anthony and I'm 7 years old. My sister Danielle died. Mary Kay came to help me. My teacher would say, "Anthony, Mary Kay's here," and then I get up, get my stuff, and I go with her, and we talk and we do some activities. Mary Kay helps me feel better.
We have other services such as case management, vocational employment services for people with a serious mental illness, as well as several options in terms of housing. We have workplace health services where employers contract with us to provide confidential counseling to their employees.
The response has been extremely favorable. Almost every employer that has contracted with us, in fact all of them, have been very happy with their services, and in the long run it is cost effective for the employer to keep the employee working. And one of the commitments that we make to all the human beings that we support is that commitment to confidentiality. In fact, within workplace health services, we do not even identify the names of the employees and their dependents to their employer. And that's our commitment. That's the model that we have. We want people to trust, and you can't heal if you don't trust.
The public education program at CMHA has a number of tools and services that they offer. We have a library here that people can access. Workshops, presentations are another that they have, one-time presentations.
And that's really critical because it's really important if we're going to support people in the community, that the community understands mental health issues and is more accepting of people with a serious mental illness.
When someone comes up to me and tells me that the weight of the world has been lifted off their shoulders as a result of participating in our workshop, I feel wonderful. I feel fabulous. It makes all the work that goes into it, and it's a lot of work, worth it. Every minute of it worth it.
I really am proud and really enjoy working with the staff because of their commitment and dedication.
Offering supportive services with a focus on advocacy, empowerment, respect, and dignity. The Windsor-Essex County branch of the Canadian Mental Health Association enhances our community while promoting mental health.
Don't despair. There is help and support available. Reach out and seek that help so that you don't have to live with that pain every day.
CMHA receives funding from the Ministry of Health to run our programs and services. However, all of the prevention services, including Grief Works for Children and our bereavement program, are funded exclusively through the United Way and community dollars raised locally.